Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today is June 18th, 2021. Doing a weekly COVID-19 update. Our website is falmouthma.gov. Our email is health@falmouthma.gov. The health department's number is 508-495-7485. So, as I think everybody knows, all the mandates pretty much went away on May 29th. The only time you would still need to wear masks are right now at Town Hall, congregate and healthcare settings, mass transportation, and K through 12 schools. So right now, that's the place you need to wear masks. In terms of gatherings and limitations that way, that is all expired. So that's where we are with guidance. If you're still looking to get a vaccine, there's plenty of doses available same or next day at the pharmacies. Barnstable County Health and the Environment is also, if you go on their website, you could register one at the 4Cs. Go on vaxfinder.mass.gov. Again, all the available sites, that'll show where the pharmacies are available, that'll show the 4Cs. Anybody who's having trouble, this hasn't gone away, so the homebound, those who can't make it to a clinic, if you find your neighbor when you come down to your summer home and you see that your neighbor hasn't been vaccinated and doesn't know what to do, again, call the senior center at 508-540-0196. We still are sending the VNA down to do homebound visits. They do somewhat still trickle in, and so we're still going to continue to do that. For everyone else, it's real simple to get a vaccine. So how are we with vaccines? We've been averaging about a 1% increase per week in the county. We're up to 74% of individuals at least one dose. That's of entire population. Those that are eligible, we're at 81%, which is a 1% increase. That's factoring out those that aren't eligible under the age of 12. And fully vaccinated went up 2%. I think it was also 2% last week. We're at 66% fully vaccinated. For us here in Falmouth, we've made slight increases, not a lot this week in first doses. We end up about 0.5%, roughly about 150 or so shots. First doses. So we're at 74%. I think that's where we were last week for first doses. We went up 2% for fully vaccinated. And obviously, as that's a delay to that. We're at 60%, a 2% increase, 20,540 fully vaccinated residents. 82% of all eligible residents have had at least one dose, and 73% of all eligible residents are fully vaccinated. So of the total population, it's 66%. It's 73% of anybody who's been eligible. So 3 out of 4 people, roughly, who are eligible in the town of Falmouth have been fully vaccinated. So the numbers are obviously slowing down. The biggest increase will be in the younger groupings that have been more recently eligible. They're 21 or 28 days for their second, well, actually it's 21 because it's only Pfizer, is up. So like we did some clinics, second dose clinics this week at the schools from the first ones that we did in May, the end of May. So that's why you see that 12% increase to 24%. So that'll continue to fill in over the next few weeks. In terms of cases, we've had 2 cases this week. So 3 total for the entire month. So we're, in 18 days into the month, we've had 3 confirmed. Actually, no probable cases. I didn't change that. We haven't had any probable cases this week. That's the rapid antigen. 2 confirmed cases, we're at 1,573. Just about all cases are out of isolations because of the slowdown in number of cases. So we're all doing really well on that front. See, the chart showed it's crashing down to close to 0, 1, 2, 3 in a week. We've flattened that curve. Definitely can see how that line has flattened out over the last month or so due to a declining number of cases. This is a state chart as updated yesterday that shows communities that are either red, yellow, green, or gray. Gray means less than 10 total cases over a 2-week span. And you can see that there's no yellow or red communities, and the vast majority of the state is in gray, which is great. All of Cape and the islands are all gray. I think it's the first time that's happened in a while, probably since the chart came out in the fall. Falmouth's positivity has gone from 0.55 to 0.51. Barnstable County is under 1. It's roughly around the same, and then the state is as well. So the positivity rate's really down. The incidence rate obviously is way down. Actually, the 2 weeks of data is actually, that didn't change that chart, but it goes up till the 12th. This data goes up to the 12th of June. In terms of cases, you can see in the Barnstable County, this is total case count since the beginning, 3-day averages. So in 3 days, we're averaging, we're averaging about one or two cases in the entire county per day. So again, that's great to see. And we haven't seen anything from the mask mandate being lifted, an increase at this point in time with the mask mandate. So the county's done, if you see in the far right, you can see that the bars are in like a dark orange color, brown color. That's when the mask mandate was lifted. So we haven't seen anything in the last, since the mandate was lifted for mask, an increase in cases. Obviously, we'll be tracking on that. ICU and hospitalizations are still right around that 1,020, so between Cape Cod and Falmouth on the 16th, last time I've got any reports, 3 hospitalizations and no one in the ICU. So that number is low because the cases are low. Statewide, we're now into under 100 cases per day, which is great to see. Our percent positivity is really low. You're still getting 1 or 2 or 3 or 4 deaths per day. There's a delay, so some of those people could have been when we were, at a higher rate, like in May or late April. There's a lag to that, but in generally speaking, that cases have dropped way, 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 way down throughout the state. Testing, you can still get a test at Falmouth Hospital, but the easiest probably is to go through the CVS's, the Community Health Center, walk-in clinics. Community Health Center also still does vaccinations, so you can get that if you went on the Barnstable County website. I failed to mention that, but Community Health is still doing vaccinations. Barnstable County is doing vaccinations. Community Health is also doing testing. Convenient MD is doing testing. CVS's are doing testing. They're also doing vaccinations. Fairgrounds is not being tested. The Fairgrounds is going to go back to being a fairground. So it's still relatively easy to get a test. We're still averaging about 500-600 tests per week. I think we're about 1,150 or so tests over a 2-week span. So we're still averaging in the 500-600 range for testing. And if you have trouble getting a test, you can always call the health department. We can sort of guide you, but they're pretty easy to find right now, and have been. So virtually all guidance is ordered, just about gone. Falmouth still does have a mask advisory, advising you should wear a mask indoors with others, into public spaces. Vaccine eligibilities is still everyone over age 12. Falmouth resident vaccination rates slightly higher than the Cape Town, definitely higher than the state, and definitely higher than the country. So some parts of the country are half of what we are. We're doing well. There's plenty of vaccines still available. Take advantage if you've been thinking about it. State metrics are showing a steady decline in cases, decrease in serious illness, no red, yellow communities, very few green communities. Our case count, 3 cases since June 1st, is great. We're 18 days into it, so everything looks good. There hasn't been an increase in cases since the mask mandate was lifted and the guidance had expired, and obviously we'll keep trying that. So I think this is going to be the last weekly update that we do, unless, God forbid something happens and we need to. I think, I'm being quite repetitive. The cases are low, our vaccination's high. We'll still post the vaccination rate on the website and the cases on the website. What I call the money slides, the one that shows you the vaccinations and the one that shows you the number of cases. We can continue to do that. I think we've done about, over 60 of these, maybe even close to 70 of these, somewhere in that range. I think we're in good shape right now. I think it's time to, that we don't need to do these on a weekly basis. I will do them if I see a need to do them. But I think it's time to not have to do these. Not that I don't want to do these, it's just that, the information, if the cases stay next to nil and our vaccination rates being as high as they are continue to increase, I think, we continue to be on a good shape. So just to recap, it's been a long year and a half for everybody, almost a year and a half. Definitely for the health department, it's been a long year and a half. And so this will be it for weekly updates unless something comes up. So thanks for everybody for listening, and take care. Thanks.